Mazars Healthcare Digest, Episode 5. Today, we're going to talk about 7 HIPAA compliance challenges for healthcare organizations to consider. My name is Justin Fraser. I am a director at Mazars Healthcare Consulting Group, and I'm here with my colleague, Diana Ramirez. How are you today, Diana?
Hi, Justin. Thank you for having me. I'm doing well.
Oh, great. Just so in the interest of time, let's jump right in. There's 7 HIPAA compliance challenges to consider. You want to introduce us to those 7 challenges?
Absolutely. These are the 7 challenges that healthcare organizations need to consider. So let's just go straight to the first one. Keeping track of laws and regulations. We can agree that, like other industries, healthcare laws and regulations are ever changing and rapidly changing. Staying informed is vital to remain compliant. So for instance, in 2020, CMS, as we know as Centers for Medicare and Medicaid Services, brought in access to Medicare and telehealth services so that beneficiaries can receive a wider range of services from their doctors without having to travel to the healthcare facility. So this new guidance also presented new ways for providing healthcare services to patients. However, those services from those covered entities still had to consider and adhere to HIPAA compliant technologies. So if they did not, they could have possibly been part of large breaches of a PHI or just in general personal information. So should a breach be identified, hefty fines could be issued to these organizations, like I said. And as you can see on the slide here, there's tier 1, tier 2, tier 3, and 4 types of fines. So it's important for organizations to stay on top of laws and regulations. By doing so, you can go to the OIG work plan, the CMS website, DHCS for their all plan letters and policy letters, be part of healthcare organizations, and of course, attend regulatory meetings and conferences to stay on top. So we'll move on to the second important HIPAA compliance challenge, and that's maintaining PHI and keeping it secured. So as you can see, being HIPAA compliant is not just, oh, we put rules, we put policies, but it's also securing. So common forms of communication such as email, fax, messaging applications, and so forth are essential in healthcare settings for organizations to get the work done. However, not always secured. We can mention a few applications out there that are not HIPAA compliant, while there are others that are. And that's what we really hope for healthcare organizations that are in particular covered entities or considered covered entities to use HIPAA compliant technologies. So securing internal and external communications is part of safeguarding PHI in all information for the organization. Working with your information technology team, the security officer, or a data official can help mitigate these risks. And some risks include, but are not limited to, as we all know, is the lack of encrypting technologies or user access, people sharing password, not using secure servers, or just simply lacking an inventory of old and new systems and just technologies. So one thing I advise is that for your staff, the enterprise, or everyone in the organization to know what to do and how to handle PHI properly. So it starts with when someone comes on board to your organization and having that new employee orientation training. Also for managers and the departments to know what to do in this situation when they come across a particular violation. Who do they report that to? So going around and rounding around the organization, talking to your staff is very important. Year-round training is very important as well in securing your external and internal communication systems. So work with your teams. You have to get out there and make sure that everyone is on point with this in particular. Number 3, protecting digital devices. Along with maintaining PHI secure, an organization should consider all the electronic equipment in use and that sends and receives data. Consider all the equipment in your organization, as I mentioned. Make sure you have an inventory list. Review that document list and ensure that you know what you have on campus or at your organization, from tablets to mobile devices, medical equipment. Depending on what your organization has, you should know and have an inventory up and review that list. Not only that, if there is equipment that will be disposed, such as old phones or pagers, it's good to know what's on those devices so that you can scrub it down, ensure that there's no PHI or PPI or any business or confidential information or proprietary information that might be disclose inadvertently by disposing of that equipment or that digital device. So very important to keep tabs on that. Next, number 4, safeguarding physical data. Breaches of digital data get the most headlines. However, we cannot forget to maintain and monitor physical records. Physical records will need to be treated with such importance and sensitivity as digital. To avoid HIPAA violations, organizations need to ensure that all staff are trained and reminded about properly disposing company documentation and anything containing PHI. Human error is common. For example, new or seasoned members can forget sometimes to dispose properly PHI or even company paperwork into the regular trash bin, and then that can cause a huge HIPAA violation, and massive breach fines and corrective actions will follow. And we don't want that. We want to avoid that. Also, although technology can be helpful to do our work, technology or technical errors can occur, such as networking printing issues. A staff member can be printing in one department, and due to a network issue, the print job could be printing in the wrong department and end up in the wrong hands. So these are common scenarios that happen at organizations, and something to consider as we continue to safeguard digital data, but also we have to safeguard physical data. So again, human error is big, as well as technical errors, and we have to be mindful of these things. And they're challenges because we're not everywhere. As privacy officers, compliance officers, it's important for us to take note of these things and investigate these matters and work with our staff and our enterprise or employees to ensure that these things don't happen. Number 5, engage in the enterprise. This is just something that I was touching upon in my last slide. It's important that we engage everyone in the organization so that all of us can do our part. Staff play an important role in maintaining HIPAA compliance and compliance in general. In an organization, whether it be small or large, there are only one compliance or privacy person, and HIPAA compliance falls on not only on them, but on everyone. It's everyone's responsibility. And it's important for the enterprise or for employees to know what to do in these situations. So what do? Here are some tips. Rounding at the hospital or at your organization is important. So when you say, well, rounding, what do you mean? I don't have time, I have to do investigations. Simple. Make time for yourself to go and meet with management, teach management, train the staff what to do in these certain situations. Have quick tips and little checklists for them to what to do. So working with your IT team is another effort. Working with your security officer, ensuring that just everyone knows what to do and how to identify these HIPAA violations or suspected violations so that we can act upon properly and address. So again, training and how to report and making sure that we remind everyone to do their part is very important. 6, moving along. So monitoring business associate agreements. As you can see, this is another important point. HIPAA requires covered entities to enter into a business associate agreement with each of their business associates to ensure PHI remains secure and protected at all times. Failure to comply with this rule leaves organizations at risk of facing significant fines and reputational damage. So it's important for us to have good communication with our vendors or just anyone that we have a BAA with. It's important for us to review our contracts with them. And even though the responsibility might fall upon them, it's important for us to keep track of or stay connected with these vendors so we can ensure we protect our clients, our patients, or our members' PHI. And lastly, we have investigations. I highlighted documentation and timeliness. These two things are very important in investigations. When a staff member of a healthcare organization, a HIPAA violation has occurred, the incident should be reported immediately to someone in management and the privacy and or compliance officer. Depending on the size of the organization, sometimes the investigations are completed or done by the compliance officer. But if they have a privacy officer or security officer, just whoever the person is that needs to address this, that they be notified immediately. It is of utmost importance for this matter to be reported timely and for the reporter to provide all details of the incident. The staff of the organization is your biggest asset in reporting and mitigating HIPAA violations and other risks. One helpful tip is to ensure that staff know how to identify potential HIPAA violations, as I mentioned earlier, and to whom to report it to. So let's just really go over these two items. So under documentation, we have ensure reporter provides as much detail and information as possible. It's very important for whoever is going to conduct the investigation. I recommend a who, what, where, when, why, and how method, because you will get as much as possible from the reporter based on what they saw or heard. Also, if they have pictures, try to get pictures, any witnesses, definitely interview people. If there's security video, try to retrieve that, or any form of video. Any form of evidence is really helpful when conducting these investigations. And again, I cannot emphasize the importance of timeliness, because depending on the matter, on the HIPAA violation, it can be connected to other regulatory requirements of timeliness, where we have to report out to DHCS or CMS or other contractual obligations with timeliness of reporting breaches or HIPAA violations. Very important. And lastly, it's a marathon, not a race. HIPAA can be difficult to comply with, but it's a necessity. It is in the best interest of the HIPAA-covered entity to be compliant. And non-compliance is non-compliance, regardless of the organization's lacking knowledge or resources. As healthcare and technology continues to evolve, we will continue to encounter new and old challenges. Maintaining HIPAA compliance can be burdensome for any size organization, and if anything, past non-compliance matters and HIPAA breaches have taught us is that all organizations are susceptible to risk and big fines. And therefore, that's why it's very important for us to consider these 7 HIPAA compliance challenges and to go back to basics and reevaluate our program and our systems. What do you think, Justin?
Well, thanks, Diana. That was a lot. Non-compliance is non-compliance. I couldn't agree with you more. How can Mazars help on an organization's journey to maintain HIPAA compliance?
Thanks, Justin, for asking. So maintaining HIPAA compliance, again, it's a challenge, and these are 7 challenges, but Mazars is here to help. And we offer several offerings for organizations, such as HIPAA assessments. We can do also policy and procedure and programmatic development. We have a high trust team that can come in and do an assessment and help them get on board. We do corrective actions. So let's just say there was an audit and there's corrective actions that they need to develop and implement. We are here to help them with those efforts, to include survey, get audit ready. There's different ways and different things that we can offer organizations to remain HIPAA compliant in these times.
Thanks, Diana. That was terrific. So let's see, if people want to get in touch with you, how would they do it?
Sure, I can be reached at Diana Ramirez at mazarsusa.com, and they can reach you as well, and here are some of our links and information. Or they can just reach out to me on LinkedIn, and we're here to help.